Somebody also asked me, what is overly affirming gender care in mental health? In my opinion, overly affirming gender care and mental health is when a therapist is a cheerleader. In other words, they're sitting there and they're completely agreeing or in a full agreement of everything you tell them about your gender identity. And they're sitting there and they're waving, cheerleading with transgender flag, eager to get you into medical transition or surgical transition. And they really do it because they think that's the way to go. They really want to support you. They really want to prevent gatekeeping from you. They really want to be there for you. And while I think that cheerleading or being so overly enthusiastic may be a good way to go to people, for example, adults who've been dealing with gender dysphoria for many, many years, who have done anything and everything they can in order to not transition, who have a lot of pain and a lot of suffering, that can be helpful to them because those people already spent a lot of time in their life figuring out their gender identity. That type of over-affirming can be not helpful to individuals who are still exploring their gender. Let's be honest, gender is broad, gender is huge, gender is very confusing. A lot of you know that you are transgender or non-binary identified or any other gender identity. You just know. You absolutely know. And a lot of you are out there who are not sure. A lot of you are trying to figure out how much of what you're feeling, how much of dysphoria you're experiencing is related to even gender identity. Maybe just a matter of modifying how you express yourself or modifying the role that you navigate. Maybe you just need a little bit more time to solidify your confidence and to feel more affirmed yourself before moving in forward. So for that reason, overly affirming cheerleading approach is not going to be a very sound approach. It's actually going to harm you and undermine you. I think the best approach is the one that is not overly cheerleading and also the one that is absolutely not gatekeeping, but the one that has a balance. It has a balanced way of being there and listening to you, validating what you say as truth, and also helping you investigate you in the terrain of who you are in relationship to your gender even more deeper. Posing to you open-ended questions that help you ask yourself other things you haven't thought about yourself. I think that's a very good, sound and balanced approach because then you get to a lot of decisions on your own. Also discussing with you all the pros and cons of transition, including all of the fears you may have in relationship to gender transition and helping you navigate those fears. So by the time you decide to move into medical or surgical transition, if that's for you, you feel confident, you feel affirmed, and you feel ready.